Ever wonder why staffing feels tight some days, or why certain resources seem scarce? The answer often lies hidden within healthcare's complex payment systems, a world most nurses were never formally taught to navigate. Medicare, Medicaid, private insurance. Fee-for-service versus value-based care. Do these terms feel distant from your daily patient care? They shouldn't. These insurance types and reimbursement models directly dictate the financial reality of your hospital, influencing everything from staffing ratios to the equipment available at the bedside. Ignoring how the money flows means ignoring forces that shape your ability to provide care. That ends now. Welcome back to the Healthcare Nurses Network and Nurses Link Up mobile app podcast series. This is Breaking the Code, Nurses Unlocking Revenue Cycle Management. This series is your essential guide, delivering the financial knowledge you deserve to navigate the full healthcare landscape effectively. In Episode 5, we pull back the curtain on insurance types and reimbursement models in healthcare written by Dr. Nicholas Abella. You'll discover the key players, how Medicare, Medicaid, and private insurers differ and impact hospital revenue. The payment game changers, understanding the critical shift from fee-for-service, volume, to value-based care, quality and outcomes. Your crucial role, why your focus on documentation, quality improvement, and patient education is more vital than ever, especially under new value-driven models. Guiding you through these essential strategies are your hosts, ICU nurse, James Carter, BSN, RN, and nurse manager, Emily Ramirez, MSN, RN. Get ready to break the code. Your RCM transformation starts right now.
Hey everyone, and welcome back to the Healthcare Nurses Network podcast. We are so excited to have you with us today. As always, we're here to empower you amazing nurses with those insights and strategies and those real-world solutions that you need out there on the front lines. And today, we are tackling a topic, well, it's really the foundation of everything in healthcare, you know?
Yeah.
And it directly impacts the resources that you have to do your job. We're talking about insurance, different types of insurance, and how healthcare actually gets paid for.
Absolutely. We're into that financial side of things today, and we've been taking into some great material from Dr. Nicholas Abella, specifically his Day 5 Insurance Types and Reimbursement Models in Healthcare.
Yes.
It's part of his 10-day series on hospital billing and revenue cycle management. Now, if you're not familiar, revenue cycle management is essentially the entire process of how hospitals, get paid for the services they provide, and our goal today is to break it all down. To distill it, pull out those crucial pieces of information to help you understand the financial currents that are flowing through the healthcare system, and more importantly, how your role every day connects to all of it.
Yes.
Think of this as your cheat sheet, your shortcut to understanding the financial landscape of your hospital, your clinic, wherever you're working.
Exactly. So we're going to explore Medicare, Medicaid, private insurance, and we're going to look at the traditional fee-for-service model, how that compares to value-based care, which is this growing trend. We want to give you a clear picture of how these financial models actually affect your institution, your workplace, and ultimately the quality of care that you're able to provide to your patients.
And Dr. Abella, right from the get-go, he emphasizes that understanding these models really it sharpens a nurse's awareness of how much patient care influences financial outcomes.
Yes.
It's a connection that we don't always think about when we're in the thick of things in our day-to-day.
That's true.
Taking vitals, administering meds, we're focused on the patient, but there's this whole financial backdrop.
It's so connected.
And he even has a great article, Mastering Health Economics for Nurses. It's a series. And one is, do you really understand health insurance? It's fantastic. We'll link it in the show notes. It's a fantastic resource for nurses who are looking to, just navigate this world and advocate for their patients better.
Yeah, it's so important. And, something that I think Dr. Abella really drives home is this direct line between the nurse's understanding of these models and the financial stability of the whole healthcare organization.
Absolutely.
The way that hospitals and clinics get paid.
Right.
Through these insurance plans, through these different methods, it dictates the resources they have access to.
Exactly.
And as you know better than anyone, that directly impacts staffing levels.
Yes.
Availability of equipment, the quality of patient care that can be delivered.
It all trickles down, doesn't it?
It really does. It's all connected.
Yeah.
So let's kind of break it down. Let's start with a specific type of insurance. Let's talk about Medicare. This is the federal program, primarily for people over 65, but it also covers some younger people with disabilities.
And Medicare really acts as kind of, if you think about it, like a benchmark in the healthcare industry.
Interesting.
Their payment structures, their reimbursement rates, they often set a standard that other insurance providers kind of follow.
Okay.
And for example, Dr. Abella points out that Medicare reimbursements, they're based on predetermined rates. And this single factor hugely influences a hospital's projected revenue and how they decide to allocate resources. Where's the money going? What departments? What services?
So as a nurse, how does understanding that help me in my day-to-day?
Well, I think, grasping this gives you, first of all, a sense of the anticipated care needs for Medicare patients, understanding that financial framework that's involved. But also, and this is huge, it really underscores the importance of thorough and accurate documentation.
Oh, absolutely.
Because that documentation isn't just for compliance, it's for the hospital to receive the appropriate reimbursement.
Right.
We actually saw in the National ADALS Center, there was a study from 2021.
Okay.
They highlighted this connection very clearly.
That makes sense.
Mm.
Okay, so we've got this kind of federal benchmark of Medicare. What about Medicaid?
So Medicaid, that's a joint program funded by both the state and the federal government, and it's designed to support individuals with low incomes. And here's where things get interesting, because the reimbursement landscape can look quite different with Medicaid.
A little trickier.
Yeah, and often presents more challenges.
More challenges for sure.
Yeah.
So Dr. Abella was noting that the reimbursement rates for Medicaid, they vary depending on the state.
That's right, big time. And often those rates don't even fully cover the actual costs of providing the care.
Wow.
So you can imagine that gap in funding can put a considerable strain on a hospital's budget, and it really necessitates careful financial management. And for nurses who work with a lot of Medicaid patients, understanding this financial reality can give you context for some of the cost-saving strategies that are in place at your hospital.
That makes sense.
Like we saw in the Revenue Cycle Management in Senior Care Report from 2023.
Oh, okay.
It's about being mindful of how you're using resources while still, of course, maintaining that excellent patient care.
Of course. Okay, so Medicare, Medicaid, we've got those two.
Yeah.
Then there's private insurance. This is employer-based plans, the marketplace, all that. What's different here?
So private insurance, generally speaking, the biggest difference is they have higher reimbursement rates compared to Medicare and Medicaid.
Okay, well, that's good.
That's the good news from a hospital revenue standpoint. But it also adds another layer of complexity.
Okay.
Private insurance often comes with more detailed billing requirements, the need for prior authorizations for certain procedures.
Yes.
You know the drill. And there's all sorts of coverage limitations that you as a nurse need to be aware of.
Right, and this is where our role, as nurses, it really becomes important in that revenue cycle.
Yeah, front and center.
Because knowing about these prior authorization requirements, making sure that documentation is accurate from the get-go.
Absolutely.
It really helps in reducing claim denials.
Big time.
And that ultimately improves the hospital's financial health.
Mm.
And I think the Saving Rural Hospitals and Strengthening Rural Healthcare report, which came out in 2020, they really highlighted that.
Really did. They drove that point home.
And, this is something I struggle with sometimes. It's like, you're so focused on the patient in front of you.
Of course.
You're trying to get them the care that they need.
Right.
And you want to make sure that it's covered. But then sometimes you're, dealing with all these different requirements.
The red tape.
It's a lot.
It can be frustrating, for sure.
Okay, so we talked about those different types of insurance. Now let's talk about the models, the ways that healthcare providers are actually paid. So we've got fee-for-service, the traditional model.
Yes, FFS.
Yeah.
This is, like you said, the more traditional approach where providers, they're reimbursed for each individual service they provide, regardless of the patient's outcome. So basically, more tests, more procedures, more visits equals more revenue.
Right, so the focus there is on quantity, not necessarily quality.
And that's the potential downside. While this can bring in a lot of money, it can kind of create this incentive to just do more,
Yeah.
even if it's not always necessary, rather than focusing on the quality and efficiency of care.
Right, and this is sometimes referred to as overutilization.
Exactly, doing more than is really needed. And this is where nurses, I think, have a really key role.
Okay.
Because incredibly accurate, detailed documentation of every single service, it becomes crucial for the hospital to get fully reimbursed for the care that was actually delivered.
Right, so that nothing gets missed.
Yeah, and the Transforming Revenue Cycle Management with Intelligent Automation report, it's from 2024, and it really touches on this like vital role of documentation.
Okay, so that's fee-for-service. Now we're seeing healthcare kind of shifting towards this other model, value-based care.
Yes, VDC. This is a big shift in how we think about healthcare payments.
Big shift, yeah. So tell me about it.
So instead of just paying for the sheer volume of services, value-based care rewards providers for delivering high-quality care efficiently.
So it's about outcomes.
Outcomes, exactly. So
Yeah.
hospitals and clinics are incentivized to actually achieve better patient outcomes.
So that's things like reducing readmissions to the hospital,
Absolutely.
preventing complications during a patient's stay, managing chronic conditions effectively.
All of that. And if they do well in these areas, they get increased reimbursement.
Okay.
So it's a win-win, right? Better care, better outcomes, and the hospital's rewarded for it.
Right. So where do nurses fit into this new model?
Nurses are critical in value-based care. I mean, your expertise really shines here.
Oh, that's great.
You know, following those evidence-based practices, making sure documentation is top-notch, collaborating on those patient care plans that are designed to meet those quality benchmarks. All of this directly impacts whether or not the hospital meets the criteria for optimal reimbursement.
That's a lot of responsibility.
It is, but it's also a great opportunity for nurses to really lead the way in this shift towards value-based care.
Absolutely. And Dr. Abele, he actually has a really great article on this too, called How Nurses Can Improve Patient Outcomes Under Value-Based Care.
Yes, that's a must-read.
It really dives into, how essential nurses are in making sure that those care plans are effective. Preventative measures are being implemented. Quality benchmarks are being met. It's about maximizing patient well-being, but also ensuring that financial sustainability.
Absolutely. We can't have one without the other.
Okay, so we've looked at these different insurance types. We've looked at these reimbursement models. Now let's talk about the impact this has on the resources that are available at your hospital or your clinic, and ultimately the patient care that you're providing.
Yeah.
So we talked earlier about how, those lower reimbursement rates from Medicare and Medicaid,
Yeah.
they can really create those financial challenges for hospitals.
And it's especially tough for facilities that serve a large population of patients who are covered by these payers.
Right.
Think about rural hospitals, community hospitals. Dr. Abella gives this example, a rural hospital in a low-income area.
Yeah.
Most of their patients are on Medicare or Medicaid,
Right.
and those lower reimbursement rates, they translate directly into budget constraints.
I see.
And that can mean tough decisions about things like staffing levels.
Which could lead to, not ideal nurse-to-patient ratio.
Exactly. And the Revenue Cycle Home Health Insight Report, which came out in 2023, really spoke to these challenges.
And the consequences of these budget limitations, they're significant.
Absolutely.
It's increased workload for nurses.
More stress, potential for burnout,
Yeah.
and unfortunately, the potential for compromised patient care quality.
And then these hospitals, they might even have trouble accessing the latest medical equipment and supplies.
Exactly.
And so nurses are having to be even more resourceful than they already are.
More creative, more efficient, doing more with less. But it's important to remember, nurses are also a key part of the solution here.
Okay. Yeah. Tell me more about that.
Dr. Abella, he highlights this crucial role that nurses play in navigating these reimbursement challenges.
Yeah.
You're on the front lines, optimizing resources, making sure that the care you provide aligns with the requirements of these different financial models.
So for instance, in the value-based care model.
Exactly. Think about patient education, especially at discharge.
Oh, yeah?
If a nurse takes the time to make sure a patient, say they've just had surgery and they have a complicated medication regimen, if that nurse makes sure they fully understand their instructions, they're helping to prevent complications. They're helping to prevent readmissions.
Which are expensive.
Huge metric in value-based reimbursement. And the impact of evidence-based nursing leadership in healthcare settings from 2024, they really talk about this, how nurses are making that difference.
Wow. So nurses are really driving these better outcomes.
Absolutely.
So it's not just about, following doctor's orders or care plans.
It's more than that.
It's also about that detailed documentation.
Yes, your documentation, it matters. Thorough notes, preventative measures, management of chronic conditions.
Okay.
All of this supports the hospital's efforts to meet those reimbursement standards and get the funding to maintain high-quality care.
All connected.
All connected. And the impact of value-based payment models for networks of care from 2023, that report really underscores this connection.
Wow. Okay, so we've talked about a lot here.
We have a lot of information.
What are some concrete steps that nurses can take, in their day-to-day to really support this reimbursement efficiency and, the financial health of their institutions?
Well, first and foremost, keep that focus on providing the absolute highest quality patient care and meticulous documentation.
Okay.
Those accurate, thorough patient care records, they're the foundation of a hospital's ability to comply with value-based care standards, and they enhance reimbursement.
Okay, so that's number one. Just stay focused on that high-quality care.
Absolutely. Now, number two, get involved in quality improvement initiatives at your hospital, the ones that align with those value-based care goals. Your participation can directly impact patient outcomes, help meet those benchmarks, and contribute to better reimbursement.
So be proactive.
Exactly.
Well,
And lastly, collaboration is key.
always.
Work closely with your colleagues in case management, the admitting teams.
Okay.
These are the folks who are often more directly involved with those insurance types and requirements.
Right.
By communicating effectively, you're making sure that all aspects of the patient's care are aligned with those reimbursement standards and the hospital's policies.
So it's about working together to streamline those processes.
Exactly, and avoid those documentation gaps that can cause issues later on.
Yeah, nobody wants that. All right, so before we wrap up, let's address a couple of common misunderstandings that we often hear when we talk about this.
Yeah, let's bust some myths.
Myth number one, insurance and billing are administrative roles.
Right.
They have nothing to do with nursing. But, as we've discussed, the reality is your documentation is critical for accurate billing,
Absolutely.
for meeting those payer requirements.
It's a direct link between the care you provide and the financial well-being of your workplace.
And the other myth that we hear sometimes is learning about different insurance types won't affect how I care for my patients.
Mm-hmm.
But what we've seen is that understanding these structures, it can change how you approach documentation,
Yeah.
the patient education, the discharge planning.
And all of that leads to smoother reimbursement processes and better continuity of care for your patients.
So it does matter.
It really does.
Okay, so for nurses who are listening, who are saying, okay, this is important, I want to learn more, where do we even begin?
Start with the basics. Get familiar with the requirements of the most common insurance types you see at your hospital.
Okay.
See if there are any training sessions offered on documentation standards.
Okay.
And don't be shy. Reach out to the billing department,
Okay.
have a chat with them, clarify any questions you have.
Good advice. So nurses who understand these foundational pieces,
Mm-hmm.
they're really vital in creating that financially sustainable healthcare system.
Absolutely. Especially as we move towards these models that emphasize cost-effectiveness and quality.
Right, because we want both.
We need both. And by aligning your practices with those reimbursement goals, you're helping secure the resources to provide that high-quality care that your patients deserve.
It's amazing how it all ties together.
It really is interconnected.
Okay, so we've covered a lot of ground today. It's been such an insightful conversation, really highlighting that connection between the incredible care that you provide every day and the financial health of the healthcare system.
Yeah, it's a big picture view, but it matters.
It really does. And we believe that understanding these intricacies, it really empowers you to be even more effective in your work and advocate for your patients.
And we want to support you in that. So we encourage you to take that next step, keep learning, connect with a community of nurses who are passionate about this.
Yes. Join us at the Healthcare Nurses Network.
You can visit our website, healthcarenurses.net. It's a fantastic resource for continuing education, connecting with your peers.
Yes, and download the Nurses Link Up app.
It's available on both the Apple App Store and Google Play Store, and it's a great way to have that support system right at your fingertips wherever you are.
So here's a final thought for you to consider. How might a deeper understanding of your specific institution's reimbursement model influence the way you prioritize and document your patient education efforts?
It's something to think about. How can you impact both patient outcomes and the financial stability of your workplace?
Thank you so much for listening to the Healthcare Nurses Network podcast.
We'll see you next time.